Good evening and welcome to our COVID-19 update. At this hour, I am Ladi Akere-Doluale. Here are the highlights. Nigeria crosses the 50,000 case mark with almost 1,000 deaths recorded from COVID-19. National Orientation Agency says states have done little to ensure compliance to the COVID-19 guidelines on schools. Lawmakers in Brazil have overturned the president's veto on wearing face masks in schools, places of worship, and businesses, just as almost 3.5 million cases are confirmed there. It's now official. The number of COVID-19 cases in Nigeria has passed the 50,000 mark. The chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, at today's Presidential Task Force briefing in the nation's capital, Abuja, reiterated the figures as announced by the Nigeria Center for Disease Control, the NCDC. Mr. Mustafa, who is also the secretary to the government of the Federation, acknowledged that many of those who died from the pandemic are medical workers. He also admitted that the cases reported among students who are writing the WAEC examinations call for concern and action by the Ministry of Education.
Now, confirmed cases of COVID-19 have crossed the 50,000 mark, standing at 50,488, and a death toll of 985, bringing us close to the unenviable record of 1,000 fatalities. These records are not landmarks to be celebrated, especially as every single death further underscores the grief and pains of families and friends, scattered lives that could have contributed to national development and are bridging God's purpose for the lost souls. This is aptly demonstrated by the fact that 14 of these paid the supreme sacrifice as they were doctors who toiled daily to save lives. We have continually prayed for the repose of all that lost their souls and worked to ensure that their death are not in vain. The most edifying tribute and respect we can pay to these people is to do the basic minimum in avoiding such fatalities in the future. The Presidential Task Force will therefore not fail to continue on the path of moral persuasion, because the superiority of personal conviction on grounds of morality remains a more effective and dignified approach in appealing to our individual and collective conscience on the need to wear our mask properly, maintain social distancing, avoid crowded places, and continue to maintain personal hygiene.
Secretary to the Government of the Federation and Chairman of the PTF on COVID-19, Boss Mustafa. Let's look at COVID-19 protocols and public transportation in Ekiti State, where it is observed that passengers and park operators have imbibed the new normal culture. But transporters in the state have other concerns. Our correspondent, Babajide Agbeyo, has the details.
A visit to motor parks in Ekiti State shows that passengers have been complying with COVID-19 protocols as spelled out by the managers of the park. Vehicles that are Lagos and Ibadan bound, among others, have passengers spaced as expected, and they have also been observing the hand-washing rules. Passengers say they are in love with the physical distance and other measures put in place.
The price has gone up beyond the usual that we used to pay. And I also noticed that there are just two passengers on the same seat, which gives room for 2 meters social distance as stipulated by the COVID-19 rules. Those are things I've noticed.
For the driver union leaders, profit making is a major challenge.
We have only problem about money, but there's nothing we can do. For now, we are taking the 3-3 on seat. We are taking 225 go to Lagos. But now, we have taken 3-5, 2-2 on seat now. But there is no shortage. There's nothing you can do. Since people now know what is going on in this nation, that's what is happening.
For now, these protocols remain, and passengers and commercial drivers will only have to adjust and cope while the period lasts. Babajide Agbe for COVID-19 update.
Thank you, Babajide. Let's go to the Unizik temporary junction in Oka, a major motor park in Anambra State. Seeing that the times are different, the transport companies who don't wish to have their parks shut down have been sensitizing passengers on the need to stay safe. But some of the passengers say the strict compliance to the preventive protocols has increased the transport fares. Meanwhile, the state has employed the services of several security agencies to ensure effective enforcement of some of the preventive protocols put in place for transporters.
At the Unizik temporary junction, Oka, where several transport companies have their parks located, it is a beehive of activities as passengers board vehicles that will convey them to their destinations. The times are different, and the transport companies not wishing to have their parks shut down comply with the COVID-19 preventive protocol strictly, with some park officials also seen enlightening passengers on the need to stay safe. Some of the passengers expressed their observations as well as point out that the strict compliance to the preventive protocols has brought about a hike in transport fare.
When I was coming, they did exactly well. Two passengers per passenger seats, and in front, one passenger. They're really keeping the rules and regulations.
Like before, they used to carry full seats and the standing. That making it not comfortable for everybody. But now, since this COVID-19, now they are carrying only full seat.
We're always compliant. We'll make sure that all our passengers are properly masked, and we'll keep the washing, running water, and soap. We also ensure that each passenger is being checked before boarding.
The State Commissioner for Transport, Mr. Afam Banefo, discloses that the ministry has deployed the services of several security agencies to ensure effective enforcement of some of the preventive protocols put in place for transporters.
You get the FRC, you get an ATMA team, you get an enforcement team approved by the state government who are out there making sure that passengers who are in keke, passengers who are on transport with the drivers are all compliant.
The Anambra State Ministry of Transport has intensified enlightenment visits to motor parks across the state to educate motorists on safety measures toward containing the coronavirus pandemic. And the government says it will sustain intervention measures aimed at keeping the virus away from Anambra.
From the southeast, let's go up north, shall we? The level of compliance for COVID-19 protocols amongst commuters plying intra- and interstate transportation in Plateau State has been described as low, with very little adherence to directives aimed at curtailing the pandemic. In spite of measures put in place by the state government to enforce compliance, it seems the citizens are not convinced on the dangers of the pandemic and are yet to fully embrace the directives on constant hand washing and the use of hand sanitizers, as well as wearing of face masks and keeping physical distance.
Residents hailing vehicles in Jos, considering that there are no designated parks and bus stops for intrastate transportation, commuters are subjected to patronized roadside commercial vehicles without regards for safety. But at the interstate motor parks, there is some level of compliance where running water were provided for passengers to wash their hands and wear their face masks before gaining entrance into the park.
First of all, before you enter the park, we have to look at you. If you don't have face mask, you are not going to enter, no matter who you are. Unless you have your face mask before we allow you to enter the park. And others, they used to buy their face mask outside before they enter. And we have a sanitizer there. If you don't have it, even you have it, you wash your hand before you enter the park too.
However, it's business as usual, regarding the physical distancing directives, as these are flouted by everyone, traders, motorists and passengers alike.
From what I'm seeing here, I don't think it's being followed, because if we're to follow the normal guidelines, it's supposed to be, let's say 2 because of the social distance, but I was told we're to see 3. That's 3-3-1 instead of 2-2-1.
The Plateau State government is calling on citizens to take responsibility to complement efforts towards curtailing the spread of the coronavirus.
It's not everything that is enforcement. The people have to be responsible to know that they are responsible for the lives and well-being of themselves, their neighbors, their family members, by following the protocols. Hand hygiene is key, social distance is key, wearing a face mask, especially in enclosed places, offices, shops, in the churches, mosques, all the worship centers. And then respiratory hygiene. People should know they should not just cough into their hands. They cough into this way, or they use a tissue paper, cough inside, and dispose it in a covered dustbin.
The government says with the rate at which community spread of the pandemic is increasing, there is the need for the citizens to take up personal responsibility and adhere to the protocol directives, especially as it concerns number of passengers in commercial vehicles, both at intra and
The National Orientation Agency, in the meantime, says states have done little to ensure compliance to the COVID-19 guidelines on schools. Presenting a report on the agency's observation during the 4th and 5th week of the eased lockdown, its Director General, Mr. Garba Abari, explains that the situation is worse in public schools. Mr. Abari explains that the agency has been conducting surveys and sensitizations on the COVID-19 guidelines across the country, and adds that there's been a breach of the guidelines on public gatherings during political campaigns in Edo and Ondo states.
As schools partially resume, there has been very little conscious effort by the subnational units to adequately sensitize students and enforce the school resumption guidelines. And this particularly applies to many of the public schools. In Edo and in Ondo states, where political activities are at their peak because of the forthcoming governorship elections, the 2 state governments should prioritize the sensitization of voters' code of conduct for election during the COVID-19 pandemic. What we see, however, is a breach of the guidelines in respect of public gatherings as we keep watching the campaigns. Our field officers have reported that recently in Nasarawa State, some youths go about forcing people to remove their face masks because, according to them, the virus is not real and it does not exist.
I'm now being joined on the program by public health physician, Dr. Oladapo Asiobi. Thank you so much for your attendance today.
I'm glad to be here.
Sounds like deja vu all over again. First, the issue of schools, the issue of rallies, and then public transportation. I remember that when we first talked about this issue, when it first started, you did point out that we should go back there afterwards and check if everybody was still doing what they were doing. Well, obviously they are not in many places. And now our figures are back. We were celebrating, so to speak, some drop in the figures at some point. Now we're back to the 500. None of this seems to surprise you.
No.
Why?
There's a great mistrust between the people who are governed and the people who govern them. And just like children, the citizens watch the leadership and do as they do, not do as they say. the Director General of the National Orientation Agency did mention that at the highest level of governance, when it comes to political activity, we disobey these rules. This health advisory that we set, the highest level of government now disobey when it comes to political rally or things that has to do with people in government. And then you turn back in the morning and say, please forget what we did yesterday, do something different. And you tell them, it is real, it is real. If it's so real, why did you disobey? And it is real, but you are sending the message that it's not real because you are disobeying. If you wanted it, if you wanted people to obey, then you will not do what will make them disobey. So that's one. However, there's a basic one that the citizens don't trust their leadership. So they look at, what I hear people say is, when we were hungry, we were on lockdown, nobody listened to us. We are free now to move around. You are saying we should curtail our movement. If you had loved us so much, you should have taken care of us then. Then we will know that it is what you feel for us is real love. The type of survival love. Quite a lot of people have observed that a lot of the political and senior leadership use medical mask. And you say it is only for the medical. But you disobey that. And so how do people trust you and follow you? Now, the low testing or the low results then was because of low testing. It wasn't because we were getting to a peak. No. We still don't.
This is not a second spike.
We are not in any second spike. We have not even got into any spike because we don't know the spike. We have not tested, we are testing less than 15 per 10,000. That's really low. So really, we're responding theoretically, not based on facts and figures that we have. We're just responding theoretically. Okay, people are too hungry, let them go. People are complaining, let them do. Religious leaders are complaining, we want to worship, then let them open. Then you look around, okay, everybody is opening now around the world. Let us just open a bit. It's not based on the data we have. Let's be honest about that.
But then you're even questioning the data that we have. So I'm going to come to you on that. Let's take a break. Let's take a quick break. We'll come back with Dr. Asiobi and talk a bit more about what has come out from all of these figures, all this data, and all the surveys and reports that we have before us. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Before the break, we were talking to Dr. Oladapo Asiobi, a public health physician. Dr. Asiobi, the stats, the facts, the visuals, the reports all point in one direction. We don't seem to have gotten a handle on this thing. Just under 400,000 tests. I think it was 380
something.
That's it. And you have 50,000 plus cases. If you take that and extrapolate against our general population, the number is scary. If everybody eventually got tested, the number is really scary. Which is why there are those who ask the question, when they say South Africa, for example, has the highest case burden on the African continent, the question is on the basis of how many tests. Yet people are not showing up for testing now that we have the facilities. Before we didn't have the facilities. Now we have the facilities, they're not showing up. They're not complying with the protocols. Do you think at this point we should just throw our hands in the air and let the devil catch the hindmost?
That would be suicidal, more than we think. We may never know the full impact of COVID on our population, but it still will be responsible of us to throw our hands in the air in a defeatist atmosphere. I think the government can take the bull by the horn now and do right by the people and gain the trust of the people back so that moving forward, whatever information government has or advice, people will take it. I mean, if we're, like you said, less than 400,000 tests of 200 billion, that is less than 15 per 10,000. That is too small to extrapolate. It's like having a family of 10,000 people. Then you know the situation of 15. And that's okay, let's just assume that's what happened to the remaining 10,000. I mean, this TV station would have nothing less than, let's say, 200 to 300 staff. Then just one person, you know the situation of that person. Okay, that's what happens to everybody in channels. It will be foolhardy. So you cannot, so that's why I said we are responding blindly. But that's the best we can do for now. So we'll go back to re-educating people about the risk that they face not complying, and show them the effect of non-compliance amongst people they trust. With public health physicians and others have said this, we need to change the strategy of risk communication, use those the people believe and trust to get to them. We're still not doing it. This has been said for like 3 months. By now, I expect on-air personalities that the people trust in the entertainment industry, in the religious body, engage the people. If those ones speak, the whole community listen. But if people in government, they just look at us with some distrust and like, see what you are doing. You can imagine if a very popular on-air personality goes to test, that video or that tweet will go viral. And we're like, wow, if this person we trust can test, you hear people say, it's true, low. Those are the things that would drive people to take up more tests, because the testing sites are not hitting their maximum.
Quite a number of testing sites,
but the figures are not matching up to them.
Are not matching up
yes.
to the
so you need people who will drive people there. Those they trust. Use them. Use the people they see on TV. Use programs they watch a lot and drive it, so that they will know. I mean, radio personalities, people they hear and they laugh. You know, we're a very fun-loving people. Go to the motor park, take the leadership of the National Union of Road Transport Workers. They have a voice. If those people tell the motor park, for lack of a better word, motor park members that if you don't test, you cannot move your bus today. Believe you me.
Everybody will be at the
Believe me, their word is law, even stronger than that of those in government. So those are the things we need. If those ones speak for us, come to the media, speak to their members, this story will change.
That gives me something else, of course. Quite a number of people talk about enforcement. Even today, the Minister of Health and a number of the others on the PTF still talked about the importance of moral suasion, persuading the people that this is in their interest, and so on. But this is 6 months. By the end of next week or thereabouts, it will be 6 months since the first case was diagnosed in Nigeria. And yet we're still talking about moral suasion. Enforcement in other societies seems to add to the bag of tools that can be used to ensure that one gets a handle of this. But we seem to be shying away quite a bit from that.
No, I don't think we're shying. It's just that even the people who enforce are part of the society. So I don't know how they will believe it to enforce on their fellow citizens when they themselves don't even believe. That's one. Two, is that enforcement is actually meant for 5% aberrant members of the society. Those who understand a bit of normal distribution statistics know that the extreme 5% are the ones that we should think about when it comes to aberrant situations like that. So majority of people will fall under the 95% good behavior.
Who comply.
In normal societies. So, but here, we have more than that. So how would you, people who are less than, well, I'm not sure our total combined, whether police, army, put together, all the forces, I'm not sure they're up to 1 million. It will be. So let's say they're 1 million. So you're saying one policeman should be chasing 200 people. or one army, the guy will just die on the job. Normally, they should do 1 to 10 max.
Right.
So we are doing like times 20.
But does it scare you that there is a possibility that COVID-19 will become like HIV and AIDS, tuberculosis, malaria, and other such diseases that we learn to live with?
Yes and no. Yes, in the sense that it's here to stay. Know that, don't worry, the whole world is ramping up the research and development to ensure that we get the vaccine. Because outside these shores, they're really serious. I was looking at the research and development budget of a big pharmaceutical company, AstraZeneca. You'll be surprised that it's about $5 trillion. Like 50 times the national budget of Nigeria. We can't compete. Let's just wait. When the vaccines come, we'll follow suit and give the shots to our people.
All right, then. Thank you so very much, Dr. Oladapo before your time this evening. Thank you for
You're welcome.
Nigeria's daily COVID-19 cases have spiked to 593, the highest in almost 1 month. The last time Nigeria recorded over 500 cases was on Tuesday, July the 28th, with 624 cases. And ever since then, the average has been less than 400 cases per day. It's not clear what caused this spike as Nigeria gradually reopens economic, religious, and social activities with worship centers, schools, and other public places coming back to life. 50,488 cases of COVID-19 have been confirmed so far, with 37,304 discharged, and unfortunately, 985 deaths. A breakdown of the latest figures as released by the NCDC shows 15 states and the FCT account for the 593 cases. Plateau has 186 of those cases, Lagos 172, the FCT 62, Oyo 27, Delta 25, Rivers 20, Ondo 19, Edo 18, Kaduna 17, Enugu 12, Akwa Ibom 10, Ogun 7, Abia and Gombe 6, Kano and Osun 3 cases each. Following the increase in the number of COVID-19 cases in Plateau State, as you just heard, 186, the government there says this is due to an increase in community testing for the disease, as Plateau State now has 3 testing centers at the NVRI VOM Plateau State Specialist Hospital and the Jos University Teaching Hospital. According to the State Commissioner of Information and Communication, Dan Majang, a slow pace of processing samples has resulted in backlogs that account for the high figures recorded against the state by the NCDC, which might be misconstrued as daily figures. Mr. Majang said in a statement that despite of the increase in awareness about the pandemic in the state, government has noted wide non-adherence and or compliance to laid down protocols of wearing face masks, social distancing, and hand washing by many citizens. Take a look at this automatic disinfectant chamber built by 3 youngsters from Jos, Plateau State in the north-central region of Nigeria as part of research to curtail the spread of COVID-19. What's unique about this chamber is that it only allows persons with face masks access into public spaces where such chambers are installed. It took William Gang and his team 3 months to build this chamber after they had resuscitated moribund ventilators at the Jos University Teaching Hospital. The fully automated system is said to have an instant temperature test, data recording system with full body disinfectant, as well as automatic hand sanitizers.
On this, the system has a motion detecting sensor. I also have a camera where you process the image and checks whether the person is having face mask or is not having face mask before it allows the doors to open automatically. So, and the system is fully automated. So one of the main reasons of making it fully automated is to avoid any form of contact. So in the system there's no form of contact where you need your hands to open the curtain or you need your hands to open the door and the rest. So everything is being designed, and the system also have a software where you can control the system remotely from anywhere, and you can also view and record most of the information happening in front of this. So if there's any form of manipulation or to manipulate the system, there's a recording video on it where the security person in charge or the ICT person in charge will actually notify the individual.
A person with disabilities, fully body disinfectant, instantly temperature test, and it's noiseless, automatic hand sanitizer, automatic cooling system, self-evacuation, wireless communication, operating without third person.
Let's move over to Kent in England, from where a family medicine physician, Dr. Sule Hassan, joins us via Skype. Good evening, Dr. Hassan. Thank you for your time this evening.
Good evening. Thank you for having me.
Let's take a look at, first of all, the situation report in the UK. The situation there is very different from ours here in Nigeria. Bring us up to speed, can you?
Well, with these are really not, you cannot compare the two statistics. In Nigeria, Nigeria, as far as I'm concerned, is a non-tester country, a population of 200 million people, and you are talking about having done 500,000 tests. That's less than 0.02%. You can't really compare that with any European country, really. But with the COVID-19 situation in UK, things are getting better. We have spots where we have the fear now actually in UK is about fear of a second wave coming in certain spots. And this is being monitored closely and appropriate measures taken accordingly, which is completely in contrast with what is going on in Nigeria. With really no testing facilities and no clear government policy, I will say, to protect the people or to gain the trust of the people and carry the people.
Quite a lot of people, Dr. Hassan, quite a lot of people did die in the United Kingdom of COVID-19. And many of those people had relatives, they had people that were fairly well, some of them were some of those who contacted COVID-19 were very well known, including the Prime Minister. And so do you think this helped shape in any way the kind of response that the UK had in terms of strategy to COVID-19, as opposed to our own situation here where 6 months down the line, people are still shrugging their shoulders and saying, well, nothing's really happening?
As I said, they are really two uncomparables because you have to look at the demographics. In Nigeria, I would say we are a population of 200 million people. More than 70% of the population, they are under the age of 30. And only about 2.5% of Nigerians are above the age of 65. So we are talking about 5 million Nigerians who are above the age of 65, and these are the vulnerable people. And if you look at all the deaths you have had in Nigeria, you will see there are people who are above the age of 65. Talk of Ajimobi, talk of Mewada, talk of Buruji, talk of Issa Funtua, talk of Mekanti, Baru, the former NNPC GMD. So, whereas in UK or in Europe generally, the older population are more. They have less younger people and they have more old people. Nigeria, we have bustling young people. And this is why you have not seen this level of deaths in Nigeria, really, because we know if a young person gets COVID, he is not at high risk. He's not likely going to die, compared to if somebody above the age of 65 gets COVID. Above 65 is a risk factor for death. Your age, your sex, your ethnicity are risk factors, non-modifiable risk factors. So the older you are, the more likely you will die from COVID. But there are also modifiable risk factors for COVID, like having hypertension, diabetes, obesity, sedentary lifestyle, poor control of diabetes and hypertension. So these are modifiable factors, risk factors for COVID. You cannot really compare UK COVID statistics with Nigerian statistics because our population demographic is completely different.
In that case, let's talk a little bit about the issue of opening up and the risks that brings. Nigeria, of course, is opening up, but the UK took the lead in that sense in many ways, even in Europe, in opening things up back. Although there have been a few setbacks with renewed cases and what some people described as a second spike. Can you update us on that situation? What is the situation as the UK has opened up now with regards to its COVID-19 strategy and what has happened?
Well, you are talking about transport, basically public transport. The public transport system is opening. There are strict measures being applied. People have to wear face coverings, and the social distancing is being encouraged, but it's not possible in all situations. Measures are being taken to protect transport workers, and the police are being authorized to fine people if they are not wearing face masks. I find this more reasonable than what we have in Nigeria doing mobile courts. Mobile courts are not really a cost-effective measure of enforcing regulations. It takes time and it's cost. It's better to authorize the police to fine people and get it done and then and move on. So with UK, yes, UK is opening up in terms of public transport. There have been guidelines that have been out. People should sit side by side. People shouldn't face each other. People can sit behind themselves and let ventilations, open down the windows and things like that in a moving vehicle. But what the policy actually encourages is that people should walk to their workplaces. People should cycle to their workplaces. So Nigeria also can think in terms of that. We may not be able to cycle because cycling is not very safe in Nigeria, but we could sort of consider the keke napep and use it sort of as a more viable form of transportation. In our airports, we could authorize the fan association to provide private car hires, which will ensure social distancing, that is less passengers. And the Lagos State has been known, the panel beaters there are known to be very creative. And I'm wondering why they haven't really created things to separate the driver's compartment from the passenger's compartment. That will help to protect the driver from direct exposure to the passengers. So yes, we have to open up since transport has to go back to normal. But when we talk about public transport, even the World Health Organization says clearly the first thing we should do is a self-risk assessment. So if you are highly vulnerable, you shouldn't travel. And we know those who are highly vulnerable. There are 6 risk factors. You are Black, you are male, you are above the age of 60, you have hypertension, diabetes, HIV, leukemia, you are on treatment for leukemia or cancer, you've had an organ transplant, and you are obese. So if you are fat, really, it's a risk factor for death if you get COVID. People are immobile. People should stop. People should get more active, exercise. And if you look at the ones who have been dying in Nigeria, they are relatively affluent, more likely to have diabetes, hypertension, more likely to be very large, obese, and more likely to be less active. They are not exercising as such. The average Nigerian is young, he's active, he's walking miles, so his risk for COVID is low. There is a high rate of infection in Nigeria, only that the younger people are being infected and they are not being symptomatic, or they're having only a light form of illness, a mild form of illness. So we think it's not there. I believe the rate in Nigeria will be almost like 30% rate of infection, not this correct thing that is being said in Nigeria. And that is the reason why I think public transport will be okay in Nigeria, because if we encourage the young people to travel and we protect or shield the older people above the age of 65. So my advice really to the government is to sort of re-strategize the policy in Nigeria to protect the older ones and allow the younger ones to go about. That is the policy Sweden, for example, adopted. It is called herd immunity. So you are not giving up. You are not saying I'm doing nothing, but you are encouraging the younger ones to have infection, and they're hoping that there will be an immunity developed in the community, which will then protect the vulnerable people.
It's on that optimistic note that we should hang it. Thank you very much, Dr. Hassan, for your perspective on the program tonight. Thank you for your time.
Thank you. Thank you for having me.
Dr. Hassan joined us from Kent in England. An Air Peace flight would about now have arrived in Lagos with the evacuation of 200 passengers returning to the country for various reasons. This is the second of such special flights from South Africa, and the passengers are mostly Nigerians. South Africa, however, is yet to open up for international commercial flights. The Air Peace flight is expected to go on to Abuja from Lagos.
We have 200 on the list of those who have made commitment and paid, but we don't know how many will go into the aircraft, because sometimes some people will decline at the last minute. The flight is going to Lagos because a great number of the people, about 140, 50, is dropping in Lagos. So once they get to Lagos, they'll make the arrangement to take the others to Abuja.
Lawmakers in Brazil have overturned the president's veto on the wearing of masks in schools, places of worship, and businesses. Congress had passed a bill at the beginning of July, which made the wearing of face coverings in enclosed spaces mandatory, but President Jair Bolsonaro vetoed the article, arguing that it could lead to people being forced to wear masks in their own homes. Meanwhile, the World Health Organization says more European countries are seeing a rise in COVID-19 cases, with Spain, Italy, and Germany reporting their highest daily figures in months.
The World Health Organization also says the number of new cases appearing in countries such as Croatia and the Western Balkans has been a source of concern since June. The agency's senior emergency officer, Dr. Catherine Smallwood, called the region a sub-regional hotspot for COVID-19, but says a leveling off of new infections was now being seen in some countries.
The situation in the Western Balkans has been a concern of ours since early June, when we started to see cases increase, and it's been very much a sort of sub-regional hotspot over the summer period.
In other parts of Europe, Belgium, for instance, the Prime Minister, Sophie Wilms, has announced a loosening of restrictions as the number of new cases decreases in the country. She said people will no longer be required to do shopping alone and could be accompanied with another person starting from August 24th. Madrid has carried out mass coronavirus tests as part of a plan to curb the spread of COVID-19 in the Spanish capital. Many people from Vallecas neighborhood received a message from their local health center asking them to attend Federico Montseny Hospital to get tested for the virus. With less than 2 weeks left for school holidays, the country's lack of a plan to safely reopen classrooms amid soaring coronavirus infections has angered parents and teachers and drawn fierce criticism from the political opposition. The pandemic situation has recently rebounded in Croatia, with confirmed COVID-19 cases surging. The country opened its borders in July, and more than 2 million tourists converged in the last month, 54% more than the same period of last year. Most of the recent new infections happen in tourist attractions. The country currently has more than 7,000 cases of COVID-19, with 168 deaths. Moving on to Latin America, the number of coronavirus cases in Colombia has surpassed 500,000 as deaths from the virus approach 16,000 and the country nears the end of 5 months of lockdown. President Ivan Duque declared an ongoing nationwide lockdown to slow the spread of the virus in late March. It is set to continue to the end of August, with stricter limitations in some neighborhoods of the capital, Bogota, where infections are higher. Finally, the United States has reported more than 5.5 million COVID-19 cases and more than 172,965 deaths, according to the Johns Hopkins University. The state of California topped all cases with more than 643,000 cases. Cases in the states of Florida, Texas, and New York surpassed 584,000, 573,000, and 427,000, respectively.
That's our COVID-19 update for tonight. You can take a closer look at some of the COVID-19 global figures in real time. Please visit our website, channelstv.com. There you'll get all the information you need about COVID-19. There are also stories on politics, business, and sports, both in Nigeria and indeed across the world. I'm Ladi Akere Dolo Aledu. Stay safe and good night.